Hey everyone, it's Russ. Today I am excited to be joined by Natasha and Lisa, both of whom I will introduce shortly. This conversation I am particularly interested to share with you based on some recent questions and comments that I've gotten from a couple of clients, in addition to some family situations that I've dealt with where Lisa and Natasha have both played vital roles in helping us reach a really great solution. So I'm joined by Natasha Berk. She's a co-founder of Atlanta Senior Advocates. Lisa Kaufman, who some of you might recognize because we've had some of these conversations in the past, is the founder of SeniorCare Options. So first of all, I think it's awesome that we have two female entrepreneurs here in the conversation with us.
Yay.
But as evidenced by their company names, they both deal with seniors. And so what I wanted to talk about a little bit today is the role they play, the world that they operate in, and provide advice, guidance, and expertise in. And I think it will be hopefully a helpful conversation for those of you out there listening. So to kick things off, Natasha, why don't you just take a couple of seconds and tell folks a little bit about who you are and what it is you do.
Thank you so much, Russ, for having us do this. I think it's really important. My name is Natasha Berk. I am the co-founder for Atlanta Senior Advocates. And we are a placement company here in Atlanta. We started 9 years ago. So really, families come to us when they are in a situation where they need to place a loved one. And so what we end up doing is help narrowing it down. Really, the three main components of it would be care needs, location, and budget. And then we dive deeper into some of the other things that somebody may want. Our service is free. So that's what we do here in Atlanta.
Awesome. Well, thanks, Natasha. I'm glad you're here. And I have Lisa to thank for my connection with you because Lisa suggested I reach out to you just a couple of months ago, I think it was. Lisa, who I've known for a long time now. And as I mentioned, some of you watching this are probably familiar with her as well. But Lisa, why don't you take a minute and just refresh folks on who you are and what it is you do?
Sure. I'm the founder, owner of SeniorCare Options of Atlanta. It is an aging life care management provision. We are providers of patient advocacy, case coordination, and evaluations. And we work independently for families and seniors so that they can have an objective opinion of what their next steps are.
Perfect. And you both alluded to the fact that you're Atlanta based and Atlanta focused, but my hope is if folks are watching this that are outside the Atlanta area, hopefully there'll be some valuable takeaways that you could take in your conversations with experts and subject matter authorities in your local area. What really kind of prompted this conversation is a specific email that I got from a client a few weeks ago when I was sharing with her about some of the decisions my family's dealing with some of our family members. Is like she just commented that she was really not familiar with all the choices as far as senior living goes. And it's not just living, but it's also support and care, guidance. There's a lot of navigating kind of the both insurance, the medical care community, and all the moving parts in between. So maybe a good place to start, and I'll open this up to either of you, is why don't we start by kind of setting the table with the different options or the different levels maybe of senior living or senior care. And then I think that might be a good springboard to kind of carry the conversation forward.
Natasha, you can take that.
Yeah, I'll take this one. So independent living is the first step. Then you have assisted living. You then have memory care. Then you can have skilled nursing. Many times people do not even have to go to that fourth step of skilled nursing. There is also another segment called a personal care home. A lot of people do not know about these options, but they're excellent care options, especially in the area that we live in.
And we were talking before I hit record. Lisa, you'd made the comment that words matter, right? And so you were sharing, I think you've encountered physicians even who might be referring to one of those levels of care, but they might use the wrong word to describe it, and that can, in the best cases, lead to confusion. In the worst cases, it could be problematic on several levels. Do you want to talk maybe a little bit more about that and your perspective and experience on the different levels of care and maybe the considerations that go into deciding which is best for you or your loved one?
Sorry, my cat is talking. So if you hear
No
something
worries.
in the background,
This is a family friendly show. So
yes,
you're welcome.
and which is always a good reminder for me. So I find that medical professionals, who don't leave their offices, you go to them, they don't come to the home, that they are the ones that they can be the voice of authority for medical decisions and choices. You go to your physician, your primary care, your nurse practitioner, whomever, to help you determine, hey, is it time for my loved one to have a different living environment? And if they use the wrong words, because in their vernacular, it's all the same, you need some help. So oftentimes I find when there is a confusion, it's because the word nursing home got thrown around, and the individual may not need a nursing home. They may not need skilled care. They just need 24-hour supervision. This often happens when there's a dementia diagnosis and there needs to be 24-hour supervision. And there is a lot of misunderstanding and gray areas between 24-hour supervision and 24-hour care. And a doctor may just be flippant and not realizing the power of their words, that someone needs 24-hour supervision because they would be unsafe living in their own without someone who has their faculties in the case of an emergency. And they'll say, yeah, your loved one needs a nursing home. And that may not be true. They may not have a medical need for a nursing home. They just have a cognitive issue and they need 24-hour supervision. And there are a lot of other levels of care that can provide that at a fraction of the cost and a more home-like environment, less institutional, et cetera. So my question to families when they come to me asking for nursing home placement is, first of all, is there a medical need for this? And when we start talking and it turns out that there isn't, I'm like, well, who told you needed that level of care? Oh, well, my physician. Okay. I don't want to be disrespectful or disparaging, but sometimes they don't know. I mean, if you see them for 7 minutes in their office and all they do is see back-to-back patients in their office, they may not really be truly familiar with the nuances of what's available in the community.
It's so true. We face this too. I mean, we kind of chuckle a little when we get that phone call saying, I need a skilled nursing. And because it's like, well, do you have a feeding tube? Do you have a trach? Or do you have a wound? None of the above. And like you said, words do matter, and it gets stuck in their heads that this is what they need. And it's really hard to dig them out of that thought process. The other thing doctors don't realize when they say that is you don't understand the financial situation that this family is in. Skilled nursing is $11,000 a month.
For a shared room.
A shared room.
A
correct.
shared
so
room.
There's just a lot to when they say that. So yeah, that is a struggle that we have to dig families out of quite often.
So for my own clarification, so like you've talked about independent living, assisted memory care, and skilled nursing. And Lisa, you specifically mentioned like a dementia diagnosis. What's the delineation or the kind of the crossover line between say memory care and assisted living, where my understanding is they're both 24-hour supervision, but what's kind of the trigger, if for lack of a better word, that would say someone needs to move from assisted living into memory care?
Natasha, I'm going to go ahead and just start and then jump in.
Yeah, please do. And then I'll piggyback on that.
Okay. Yeah. So, there's also the term retirement living, which usually refers to independent living if you are over 55. So, but for our purposes and the care purposes, we really are looking at Assisted living, which provides a general sense of this person needs to be here because they need some help. And it usually includes an hour of time split up during the day, that there's an expectation that you're going to need some kind of help. And then there can be different levels of care. How much help does this person need in assisted living? So if it's a physical concern, they may need help with bathing or getting dressed. And so there's caregivers available really 24 hours a day to help them with whatever personal care needs they may have. And it can go from very minor supervision and setup to full on, this person needs somebody to help them dress. When we're talking about memory care, it becomes all inclusive, because not that all the payments are that way, but you can expect that with the degenerative projection of care needs, when someone has cognitive impairment, whether it be from a stroke or from Alzheimer's disease, which is the most common cause of dementia, over time, these people are going to continue to need more help as time goes on. Their condition will worsen over time. And it's a given that they're going to need more assistance to the point where they'll need total care. But if they're, they don't necessarily have to end up in a nursing home, like Natasha had said. That is no longer a given for everybody who reaches a certain age, that it is very possible to age in place to the end of life. And in Georgia, we're very fortunate that there are waivers for hospice patients, so that people can die in their own homes and not have to end up living in an institutional setting for that very final chapter, that is no longer a sentence. We'll just put it that way. So the changing needs, as people increase their needs of care, we're always looking at safety. And so the determination factor between assisted living and memory care sometimes comes down to, is this person safe to be even in an open community where they could just walk out? Mm-hmm. And if there's ever a question of wandering or confusion with days and nights, so that there's not enough staff to supervise at night, if that's when they're up, then a locked unit for memory care and higher staffing ratios may be more appropriate for that individual.
Yeah. I think what we also see, it's a failure to thrive in an assisted living environment. And I don't mean that just physically, socially, where they're sitting at the dining table, and the people that they're sitting with don't want to sit with them anymore. They start getting ostracized. Mm-hmm. And when communities recognize that, that's when they'll come to a family and say, we think it's time for your loved one to transition into memory care, because it's not the right place for them anymore. We find that it's the wandering, it's that situation. Those are really the two most common factors in making that transition over to memory care.
And I know you use the word care in place, and I know based on our conversations outside of today, we've talked about communities that offer, basically in one property or in one facility, multiple levels of care. So they might maybe start in independent, for example, and then have the option to progress into higher levels of care, support, supervision as needed. Right. But I think in my mind, something that's really stuck out in our conversation thus far is they may never need to go into a skilled nursing scenario. So how, based on your experience, how often do you find that, let's say someone that's in their mid to late 60s, for example, moves into independent living, how often do you find that they do need to kind of escalate through those different levels of care, maybe into memory or maybe into assisted living or vice versa, based on their I guess just the process of aging. I know it's going to be specific to each person, but is that more common, or do you find, because I've also talked to people that said they can go into independent living and then you can basically add services. You can hire outside companies to come in, and they could spend the rest of their life in independent living, even though they have a decline in health or cognitive function or that sort of thing. So I'm not sure if my question is clear, but how often do you see that people are fine kind of staying at the level that they enter into versus needing to progress to additional care?
Well, you said it really pretty well at the very beginning. Everybody's different.
Yeah.
So it depends what their diagnoses are, and it depends what the progression of the diagnosis is. So I guess for the clients that I see, they have a diagnosis of something, which means we're going to move through the disease process, whatever it is. Most of my clients have some sort of dementia or cognitive impairment. And a large part of those folks, it's Alzheimer's disease. It just is. So the stats on Alzheimer's disease is that if you hit, I think 65, it's 1 in 6. And if you hit 85, it's 1 in 2.
Wow.
So the stats are not great in you're going to need memory care. If you hit 85, there's a 1 in 2 chance that you'll need memory care.
Right.
And we do see a lot of people that make it to, that's the beauty of the age we live in, is that we can live longer. Part of what I think Natasha and I try to do is to make sure that people are living well.
Right.
And my goal as a care manager is to offer the ability to have the best quality of life possible at the highest independent level possible, which does not mean they're independent. We just want to foster as much as they can handle.
No, that's totally on point there. Every individual is, their own case, I guess you could say. I've got a couple right now where they're looking at independent living, but there is a diagnosis. One of the spouses just got diagnosed 2 months ago with Parkinson's. Now she's proactive. So this is early diagnosis, and she's already looking at, how do I downsize out of our 2,800 square foot home? What are the options for independent living that have a continuum of care? The other thing I do want to point out, and I don't know if Lisa finds it, the days where you move into a community and you're there, through end of life, for us, it is becoming few and far between now. We are finding, now that this is our 9th year in business, that folks that we moved into independent living when we first started this company, as they now need assisted living, they're actually not going to the assisted living at the community that they live at. They've added, a la carte services in independent living. And a lot of these independent livings have a home care company on site where you can do these third-party services. And that keeps them running for, a few more years. Some people end up just staying in independent living and having 24/7 care. There is that option. But what we're finding is that when it does come time for either assisted living or memory care, and usually I will say that the jump we're finding is that they've used third-party care and independent living, and now it's time for memory care. But they're not actually going to the community that they live at for memory care. They're looking outside those communities for those options. It could be financial. It could be, a lot of times though, it's that the care at these communities that have independent assisted memory care, they're really a lot of times at independent living. They focus on that. That is, comprises of 50 to 60% of the rooms in their building. When it comes time for memory care, we are finding that it falls off. So, I think that it's realistic to tell people these days that the dream of staying in one community the rest of your life may not be as realistic as they hope for it to be. It's the goal, but I believe in setting realistic expectations for our clients and letting them know that you could be facing 2 or 3 moves and when you start this process, when you're in your 70s.
Yeah, I have to agree with that. And I have a couple of thoughts, so hopefully I can keep them concise. One is, independent living. Yes, you can bring in services. You can do whatever you want. And I've had families who even lived in their own homes that wanted to recreate an assisted living experience. If you can afford to do that, that's great. But as a therapeutic recreation specialist, which is what my degree is in and what my clinical role is, my primary clinical role was before becoming a care manager, you're missing half of the treatment for somebody with memory impairment. It's memory impairment. It's the need for structured activity, purposeful activity, structure throughout the day, goals, etc. People with dementia lose their ability to engage, and they lose their ability to structure their own day. They don't remember what time it is. They don't remember what day it is. They don't remember to do things that need to be done, showering and whatever they think they maybe already did it. Sometimes they forget to eat. Anyway, some of these things can really be replicated well with enough care, which can be cost prohibitive for many, many people. But then there's no other, there's no extras in the scene. There's no other people there. There's no passive stimulation and socialization for people because there's no one else there. So there are a lot of secondary benefits for someone to be in a community setting, including that it can be more cost effective, is that there's other people. So I gave the example fairly recently that if you're not really feeling like showering anymore because you don't want to change your clothes, or it hurts to move, or you don't want to be wet and you get cold, or you're afraid of falling, all very true reasons why people stop showering very much. But if you add in the social reason, I don't have anywhere to go,
Right.
COVID.
Right.
How many of us
Right.
stop showering every day, right? So
Yeah.
if you have dementia and you don't have anything to do and you want to be left alone, not showering is a thing. But if there's bingo in the afternoon or a musical program or something, pick an activity of your choice, the grandkids are coming, what have you, and somebody says, hey, you got to shower because we're all going to get together and we're having a birthday party later, you're more likely to shower because there's a social pressure, if you will. It's an expectation. It's how we're conditioned.
Mhm.
Eating, people who are at home alone do not eat well. Eating is a very social activity. So if you're in the dining room, whatever size dining room, it can be a small dining room or a larger dining room, you're more likely to engage in some sort of socialization, either talking to people or just being with people, and you'll eat better. You're more likely to take your meds. Everyone else is taking their meds. You're going to, it's a peer pressure thing. But again, we're conditioned as social creatures to do these things. So when we're alone, that's when the unusual behaviors really crop up and there's much more resistance. There's also having caregivers provide care versus family members. Not that I'm knocking one or the other. There are buttons to be pressed if it's a family member that you're saying to take a shower or take your meds. Whereas if there's this, other person that you didn't raise telling you, it's time to take your meds, you're more likely to do it than to say, I raised you, you can't tell me what to do.
Right.
So there's that component to think about when you think about assisted living or independent living. You can put in whatever you want to make it work for that individual, even though assisted living might have been more appropriate. So yes, you can totally do that, but there's a cost. The other part that I find, I think this piggybacks on what Natasha was saying, is that people are skipping assisted living altogether.
Yeah.
And because they can, for a while, supplement that independent care, which is pretty much assisted living, to the point where they've missed their opportunity for community living with a supportive environment. So it can be a little bit more difficult transitioning because you've gone from this bubble into this place where the care is everywhere and everybody needs care, and you've kind of missed an opportunity. But the other piece I kind of wanted to throw out there is there's a huge stigma to shifting from one level of care to the next. So if you're in a community, a continuous care community that has all these levels, there sometimes is a huge pressure to stay independent, even though you're really not. because everyone else is going to know that you've moved over there, and then there's a stigma.
That is,
They're in memory care. Well, that's death's waiting room, so we can't talk to them anymore. They went to the other side.
yeah, that happens all the time. That is actually a big, reason why people don't stay in the community that they're in. We hear it all the time. They have names for the memory care at these communities, and I mean,
Yeah.
yeah,
Remember Miss
the dungeon,
Susie? She went
they
over
come
to
up
the
with these things.
Evergreens.
Yeah, they're over
Now we
there.
speak of Susie no more.
I know.
So she'll move to a new community where nobody knows.
Yeah,
Yeah, absolutely.
Yeah.
It's a shame.
it is.
Yeah, well, so thank you both for those comments. I find it super interesting that, I tend to look at things from primarily a financial lens just because of my role. And then you guys obviously bring expertise, both from a medical or a care perspective, but I think you've both done a nice job of highlighting the social, the lifestyle, kind of some of the intangible considerations that can play an important role, not the least of which is, if a family wants to provide care, or is the patient, the loved one, going to accept or receive that care from a family member, even if it's delivered with love and good intent, like they would from an objective third party that's
Right.
frankly getting paid to deliver the care, the news, whatever that case may be. I mean, there's a lot that goes into these decisions and evaluations.
Rife with pitfalls.
Mm-hmm.
And I think we could probably talk for quite a long time
Oh
about
my
this.
gosh. Yeah, because the financial part we deal with, there's three main components to our discovery, and one of them is financial. And so, we have to narrow down the options based on what a person has financially. And the client, they have to open up to us about their true financial situation. I mean, because as much as, the care drives it, nothing actually drives it more than what you can afford. Right? I mean,
Right.
that could be a whole nother discussion. Yeah.
Right. Well, I think we've already identified part 2, 3, and maybe more of this. So this maybe will develop into an ongoing series. But in the interest of both your time, and thank you again for joining me this morning. This has been great. Personally, I can vouch for both of you guys, having peripherally worked with you myself, with regard to other family members and loved ones, but having introduced other clients and folks to you guys and having received great feedback, I was really excited to be able to further showcase who you are and what you do to folks that might check out this conversation. But if someone's listening and they're in the Atlanta area and they want to reach out and learn more, Natasha, why don't we start with you? Will you just share how people can best get in touch or learn more about who you are and the work you're doing?
Yeah, call me. My number is 404-271-2433. A lot of what we do is education, information. If you think it's too early to call, it's not. It never is too early to call. Also, you can see our website. It's atlantasenior.advocates.com. I'm happy to talk to anybody.
Awesome. Thanks. How about you, Lisa?
I can be reached at 404-992-3453. The website is www.seniorcareopt.com. But one quick comment, if you need somebody who is in care management across the country, there's 1,900 care managers across the country, and they can be found at aginglifecare.org.
Awesome. Thank you. One other question that came to mind before we wrap up. Who typically reaches out to you? Is it the senior themselves? Is it their adult children? Would be my guess. Is that most often the case?
Yeah, the adult child.
Okay.
In a crisis.
Yeah. They're not calling you early like you're encouraging them to do, Natasha. It's usually the 11th hour.
Yeah,
Yep.
that's when it's happening. And then I'm calling Lisa saying, I need your help.
All right. All right.
And
So,
vice versa.
Yeah.
And vice versa. Oh my God.
all right. So we've got a long laundry list of items to follow up on next time we talk. Any closing comments from either of you guys before we wrap it up today?
We're coming into Thanksgiving next week. I know whenever people are watching this, but the holidays are a great time to sort of reevaluate how your loved one is doing. Don't beat yourself up that you didn't see it. When you see it, and make steps going forward. Call. You don't have to be alone in dealing with your loved one's changing needs as they age. Get help. There's help out there.
Yeah, that's actually a great point. Those moments, and I was actually just thinking about this today, that when next time I see my mom, I have got to make sure that I have all of my legal, situations in order. I need her to have her power of attorney signed. I need the advance directives, and I need her living will. So if you don't have those things from your loved one set up,
Ask for Christmas.
Yeah.
Or Hanukkah, or yeah.
Hanukkah, whatever it is.
What do you want? I want a POA.
Yeah, ask that. That's the best gift your loved ones can give you.
It really is. That's how not to be a burden.
Right.
That's a whole other topic.
We'll leave it at that.
Maybe that should be the title of this conversation. Is all I want for Christmas is a power of attorney.
Yes, I love it.
And by the way, I mean, that does not mean that your, children can put you away. It gives them no rights to that. There's a stigma to that as well. It's security in the fact that if something does happen to you or, your parent, that you can make decisions on their behalf that you would have to go through a lot of red tape to be able to do. And it would just make a hard situation even harder. So, I recommend everybody get on that.
Yeah, that's a whole other topic. If we haven't talked about the whole POA and all of that stuff, I think that would be a lovely follow-up.
Okay,
Yeah.
well, we've just set the agenda, so we've got another conversation to have here sooner than later. For now, Natasha, Lisa, thanks so much. This has been great.
Thanks,
and happy Thanksgiving.
Happy holidays.
Happy holidays to you and your families, and we'll talk again soon.
Okay, sounds good.
Bye.
Bye.